Hey everyone, welcome back. I've been wanting to do this video for a while now. I just came back from the hospital after giving an M&M presentation and I decided that I'm not going to change out of this until I make this video. And it also fits the interview vibe, so I thought it was a good idea. Now you guys must be wondering, M&M presentation? Why was I giving a presentation on M&Ms? Let me explain. So M&M or mortality and morbidity presentations are something you'll be doing as part of your residency quite likely and beyond. And they're a good learning opportunity. These are times where you're able to discuss cases where there might have been some morbidity or mortality associated with a patient's care. And it might have been secondary to an error, might have been secondary to some other reasons, systemic reasons. And these serve as a very good learning opportunity without any blame and shame. And because that's really the culture M&M presentations try to promote. So great learning opportunity. Patient safety is very important and there's always room for improvement, and that really is the foundation for quality improvement. For those who watched my previous video, you guys must be aware that we went through a lot of different commonly asked questions, and there were a lot of requests that came in asking for another video covering more questions, and that's why I decided to do this video. We're going to be discussing several other questions where I will share my thought process behind how I would approach those questions. Again, by no means the best way to answer those. It's just what I feel, how I would respond to those. You can use those as a reference and build your own responses around those responses that I will share with you guys. One important point I really want to make here is do not get nervous, don't panic when you hear a question from the interviewer in the interview, because very often, there are so many different versions of the same question. Let's say a question about your weakness or weaknesses may be asked in many different ways. So you may, for a short period of time, get that sense of panic that, oh my God, I haven't prepared for this question. But hold your horses and stay calm, because you quite likely know the answer to that question. So don't let different wording, trick you or mess you up. So stay calm, listen to the question. It's quite likely it's like a version of the more common questions you've already practiced, and then answer the question in the context of how the question was framed. So again, keep that in mind as you approach every single interview question. Without any further delay, let's get started. So the first question we're going to discuss is, what skills and qualities do you bring to the program? Now, some of the things that you might mention as part of your response to this question might be quite obvious from your application. When someone mentions that they bring leadership to the program, it would be obvious from their application that they've had previous leadership positions, that they had to handle bigger teams in, and they did perform pretty well. Some may say that they bring with them a lot of scholarly experience, and that would be evident from their application, where they may have had several different publications, many different presentations, poster presentations, and so on. So these are examples which could be supported by things in your application. And then there are other things that you could discuss which highlight more personal qualities that you have, like being a patient person, or a good communicator, a good listener, good team player, which could be evidenced by a lot of different volunteering experience you might have had previously. So don't hesitate to highlight your skills and your strengths and your qualities here. Even though it may come off, you may think it sounds like bragging, but the program needs to know what puts you apart from other applicants and what do you bring to the program. Another question usually asked is, tell me something interesting about you that is not on your CV. Now, before you think of a response to this question, try to think of what impact would you want your response to have on the program and on the interviewer. You would want to mention something that would boost your application or boost your chances at matching at that program, right? Something that would directly contribute towards your chances of matching at that program. So you would want to say something impactful, something that can have a tangible impact on the interviewer and their perception about you. So I'll give you two examples. One example is an applicant saying, oh, so something that's not on my application? Yeah, so I've been trying to gain more experience with cooking North Indian cuisine. And I've tried many different dishes like so and so and so. It's been a great experience and I've learned many different dishes and I'm getting better at it. But what impact does that have on the program. It's a fun fact. It's nice that you're learning to cook. Not trying to underestimate it in any way. It must be something that might mean a lot to you, and it's a great skill to have. Cooking is an amazing skill to have. But think of something else you might be able to mention. Anything else happening in your life that could have more of an impact. An example now would be an applicant saying that during their rotations, so during my rotations, US clinical electives, I encountered a lot of patients that were Spanish speaking, and I had difficulty communicating with them. Obviously, it would have to happen through an interpreter. To overcome that and realizing the importance of knowing the language for my patients, for the sake of my patients, when I'm in residency, I decided to learn Spanish. So I've been taking Spanish courses or learning Spanish online to improve my Spanish proficiency, and hopefully that will prove useful during residency. Now, this has a far bigger impact than the cooking example, because right now this example tells the program that you're actively improving your skills, you're actively thinking about your patients, and you're willing to learn a new language for the sake of your patients. And this is a skill that will be extremely useful in your residency. So it definitely directly affects your residency performance. So again, just to summarize and make the point that whatever you want to mention here, think of what impact it has on the interviewer. So mention something that is impactful. Another question that could be asked is, what is an ideal program to you? This question can also be reworded and asked differently as, what are your objectives from your residency training, right? Because they both kind of point at similar things. The point is, what do you want to achieve from your residency training? Where do you see yourself right after your residency training, and how can your residency training help you get there? You see how many ways there are of asking the same question. So really, you want to highlight what's important to you. It's a good question to ask. What are you trying to achieve from residency training? So some points to touch on is, first and foremost, the objective of residency training, the structured training, is to prepare you for independent practice, to practice as an attending, to be able to lead a patient's care as an attending physician. So really, everything you go through in residency is preparing you for that attending physician role, right? That's first and foremost. So with regards to that, you want to be growing in interpersonal skills, in leadership skills, in clinical skills, in diagnostic and clinical reasoning skills. So think of all these things that are really core of your residency training, because eventually that's the point for you to be able to function independently as an attending physician. So that's the first thing. That's something you would want to achieve. Something else you would want to achieve, especially if you have fellowship plans, is working towards those goals. So you would want your residency training to help you get there. And how that can happen is through the opportunities you will get in your residency training. For example, research, networking, mentorship, and all these things. So if you have fellowship program plans, your residency experience will help you get there. So that's something else you would want to achieve. You obviously also want to highlight the fact that you want to give back to the institution in whatever way you can. So you hope to get involved in the committees, in the different leadership opportunities available at the program, so you can make a difference here at this program. That means a lot to programs and to institutions. They want people who they can retain, that's one thing, but also people really having that sense of giving back to the institution in whatever way they can, or helping the institution become better, or making it a better place for others that will come after you. So, these are just some points that you can mention as part of responding to this question. And in addition to this, if you have any other objectives, any other goals from your residency training, you can obviously mention those as well. Another question usually asked is, what challenges do you expect to face when starting residency? So one method of answering this question is first, obviously, highlighting the difficulty you expect to face and connecting that with how you've been working on that, or how you've been working to make that easier. So for example, you may say that obviously as an IMG, one of the challenges you may face is a different EMR system, especially if you don't have previous experience with that EMR. So you could say that's a challenge you expect to face, but you've been actively working on it, getting to know the EMR better. You may even be able to say that yes, the EMR system might be different, but I did US clinical electives and I actually did gain some experience using that EMR. And that will definitely help me. There'll still be an orientation phase where you'll get to become more efficient with using the EMR, but given that previous experience that you have, that'll definitely help you. Another point to mention with regards to difficulty faced is some may say, interpersonally, I may face some challenges initially because I am new to the American culture and just, social kind of interactions. For that, I'm taking communication courses. I'm trying to, engage in social activities here in the US to better understand how all that works so I can be well prepared. I can be socially in touch with my patients when I'm treating them. Another aspect of challenges faced could be, just that gap in knowledge. When we come from med school to residency, it's definitely a big gap in, or a big jump in your responsibilities and the knowledge that you'll expect to have. So you could also add on that and say that, you've been kind of keeping yourself up to date clinically, participating in or, getting involved in ongoing conferences or reading up guidelines and stuff like that, research articles and stuff, and helping maybe medical students with research projects and so on. So that's one way you're kind of keeping active scholarly and academically. Another question asked in interviews is, who is your idol in life or a role model in life? I'm not going to give you examples, but obviously you want to highlight someone that has had an impact on how you approach life, how you think. It could be something personal, it could be something professional, whatever example you can relate to. But the important point would be to see how that individual helped you shape how you approach things, whether personally or professionally. It could be, maybe a finance guru who helped you manage your finances better. It could be someone in medicine, a physician or a scientist who truly inculcated that sense of research, interest, and innovation or discovery in you, and you became very involved in research because of that. It could be a faculty physician from your med school who truly inspired you with their personal characteristics, with how they approached teaching, and now you are very interested and very ambitious and want to get involved in teaching the next generation of physicians and stuff like that. So again, if you can bring up an example that had an impact on how you think, that had an impact on how you perceive and approach things, whether professionally or personally, these should be good examples as long as you can support them with certain strong points. Another question, tell me a fun fact about you. There's no limit to what things you guys might be able to say. A fun fact about me, it would be the number of languages I speak, or that I was born in the world's largest oasis. I'm gonna leave that for you guys to figure out. But really just fun facts like these. Fun facts are not always necessarily meant to be serious or professional. They can be something lighthearted and interesting. That's all there is. So you guys may have unique stories, unique things to say about yourself, but whatever fits your profile, your story, your life story, that should be good to get the job done. Another question that can be asked is focused on wellness and burnout. So programs may ask you, burnout is quite common in residency. How do you take care of yourself to prevent burnout or avoid burnout? Important question, and definitely very relevant in residency training. So here you would want to highlight what you do on a personal level and what your social support system looks like that helps you stay sane and stay healthy and well. So obviously people have different ways they handle stress. So obviously people have different ways in which they handle stress and burnout. Some people like playing the musical instruments. Some people like going on hikes, spending time with friends and family, reading books, and so on. So whatever works best for you, mention that. But there are a few layers of burnout protection that you would want to touch on. First, obviously, is personal hobbies. Secondly, is if you have a partner or a spouse, what do you guys do together? Third is your social support system, your friends and family. Do you have any friends and family in the area, in the city, in the state, in neighboring states maybe. Secondly, one thing you would want to touch on that I used to mention is, as part of residency, really an extension of your family is going to be your co-residents, and you look forward to spending time with them. Obviously, COVID kind of impacted that in a big way, but things seem to be getting back to normal. So we want to make the point that you guys would like to try and find every opportunity possible to get together on small occasions, big occasions, and spend some leisurely time. And that would in turn help develop and improve, the chemistry between co-residents, and will help, improve the work and the team spirit between them. So again, these different layers of burnout defense, as I call them, should be something you should be highlighting in your response. Let's discuss a behavioral situational question. Let's say your attending physician is pursuing a treatment modality for your patient that can cause harm to the patient. How do you approach the situation? Now, quite often, most often, when such behavioral situational questions are asked in interview settings, they're very simplified, they're almost oversimplified, right? They kind of factor out a lot of the different variables and different details that could have a big impact on how you would approach the situation. So the safest way to answer to start answering any behavioral question is to stand your ground. Don't react, don't overreact, but gain a better understanding of the situation, right? So what is happening here? Seems like the attending is trying to pursue something that's harmful to the patient. Okay. You would want to first understand what the treatment modality is and whether it's clinically indicated. Are there any clinical guidelines or recommendations that support pursuing this treatment modality? If there is no basis, or if there is a basis to pursuing this treatment modality, the next step would be to discuss that with the patient. There's a concept of iatrogenic harm, and take the example of chemotherapy. It may help treat a cancer, but it may cause some very serious side effects. All this needs to be communicated to the patient, and as long as the patient is aware of the harms and the side effects of a certain treatment, they can choose to either proceed with it or refuse that treatment, right? But all this needs to be communicated with the patient. So there is that aspect of this response, communicating and making sure that this has been communicated with the patient. If it's not clinically indicated, now that raises a concern. So why is the attending physician trying to pursue this modality? At that point, you would want to talk to the attending physician and have a conversation in a professional manner, and from a learning perspective, to better understand why it was decided for that treatment modality to be pursued. And then from there on, you can decide what response you get, and whether, if it's blatant harm that really there's no indication for that clinical modality, you would need to escalate this problem to the hospital board, to the licensing board onwards, the state licensing board, and so on, to ensure that this gets taken care of. And this is if there's evidence of blatant harm from the attending physician, where there's no clinical indication for this, there's no clinical reasoning, and it's blatant harm. But that's like an extreme case. So again, if you demonstrate this understanding, this overall understanding, and a comprehensive, wholesome understanding of the situation without overreacting or reacting too fast, that's something that the programs would like to see you do or approach by. So just make sure you show an understanding of the scenario, show an understanding of the many variables, many factors that can influence how you would approach and pursue your further action. So that's really an example of a behavioral question, but really the formula applies to most other behavioral questions. Understand the scenario best, and then slowly escalate action. I want to share one more question, just for laughs, for fun, but definitely seems like one of the common interview questions to be asked. I personally never got asked this, but the question is, if you had the chance to be an animal, which animal would you pick? Now, it obviously took me a while to think about it and truly introspect and look into myself and decide what animal would I want to be. There are a few options that I would want to pursue, and for different reasons, and I think really the purpose of this question is to see how you think and what kind of qualities you would like to possess, right? I would say, for one reason, a hawk that flies over things is so calculated in its action. You know, when the hawk, first of all, it's patient when screening or searching an area for prey, and its patient flies up there without taking action too fast or too abruptly. And once it's located a prey, located a target, then it makes this very calculated move to, capture the prey and take care of it. So that's one reason. So I think far vision, that's one quality I would like to have. And far vision in also in metaphorical sense, in the sense that, when I take an action, I want to be aware of the short-term consequences and the long-term consequences for my patients, for everything I do around me, right? So that's one kind of correlation I would make with wanting to be a hawk. Another one would be that I'd like to be an elephant. And why do I say that? First of all, elephants are super powerful. You can tell by their size, by their sheer strength. They're very powerful animals. But what's more important is that research has shown that elephants are very emotional animals. They're emotionally very connected. And that's been shown by how they mourn the loss of, a fellow elephant and so on. So again, just to highlight the fact that I would want to be emotionally in touch, or be emotionally very adaptable and flexible, be able to demonstrate emotion when needed, especially when working with patients and so on. And obviously that strength. Animals, and I mean elephants, also have a strong sense of family, community. They're there for each other when needed. So again, that sense of team spirit, that sense of support and family, I would want to also be able to have that as part of one of my qualities. So really, I mean, let me know in the comments what animal you would want to be. I'd be very interested in hearing your answers and your thought process behind it. And let's see, what we come up with. So, but these are what I would think of. Alright guys, this brings us to the end of this video. I truly hope you benefited and it helps you understand my thought process behind how I would answer those questions. And you can use that to adjust, modify, make changes, and build your own thought process, build your own approach to these questions. Well, besides that, I hope the interviews are coming in as you would have expected. If not, hang in there, be patient. We're like in mid-November. See how things go, and believe in yourself and believe in your application. Make most of every interview that comes to you. Do every interview like it's your only interview, even if it's at a program that may not be your favorite. Give your best in every single interview. That would be my advice for you. Be yourself, be natural, be cool and calm, and be awesome as always. I will see you in the next video. If there's any other questions, any concerns, always feel free to reach out, and take care of yourself. Goodbye.